Hello, I'm Dr. Spainhower, and I'd like to personally thank you for visiting my website. I personally know that finding the right solution to your pain can literally be a life-changing experience. It was for me, and it has been for hundreds of patients that I've treated over the years in my dental practice. And because I had experienced the same or similar frustrations with TMJ pain and other symptoms of clenching and grinding for most of my life, or actually since my teenage years and my early adult life, it has given me tremendous personal satisfaction to help patients finally get their life back. I firmly believe that everyone that suffers from the symptoms of clenching and grinding should have access to an effective night guard available at a price that anyone can afford. If you're like me, you're probably frustrated with the options available when it comes to night guards. There's the over-the-counter night guards and the custom night guards. So let's talk about those. The problem with every single night guard available in the retail stores and pharmacies is that they are designed to cover the back teeth. While that may seem logical in design, it actually promotes more clenching, high-intensity clenching and grinding. And that is not what you want, because clenching and grinding is causing your pain. The back teeth are designed to chew, and the molars are wired with nerves that tell the brain to chew. When the nerves sense anything touching the teeth, the back teeth, the message goes to the brain, and then the brain tells the muscles to contract. Whenever they feel anything like opposing teeth, food, or especially a plastic night guard, the brain tells the jaw muscles to chew. That's how we're designed. The teeth want to grind and chew anything they come in contact with. So when you sleep, the body's natural reaction is to clench down. And when you have a plastic night guard between your back teeth, you clench even more. So that's why many people wake up with the same pains or even more pain, because you're still clenching. In fact, many of you will identify with this, that you chew through the over-the-counter plastic night guards within just a few weeks or a few months. The other option is for a night guard is to go to a dental office such as mine and get a custom fit night guard. While that's an excellent choice and they can work very well when adjusted correctly, they are much more expensive. When not adjusted correctly, they can still encourage high pressure clenching at night. Not to mention, they're several $100s and possibly even several thousands of dollars if you go to a more experienced TMJ dentist. In 20 years, I've made hundreds of custom night guards and TMJ splints that have been effective in treating TMJ pain. But I believe you should try a conservative, low-cost solution first, because most often it does work and saves you a lot of money. If your symptoms continue after trying the conservative approach, go see your dentist or another professional that is appropriate depending on your situation. But many of you will literally save thousands of dollars and many years of frustration and pain by going with the conservative approach. Earlier in my career, as far back as my first year out of dental school, I knew it was possible to have an affordable, effective option. It has been my passion to develop a night guard that was not only effective, but affordable for anyone in the world. And that's why I'm so excited to introduce the SmartGuard Night Guard. I've spent the last almost 4 years designing, redesigning, and redesigning, and redesigning to perfect the SmartGuard, to make what I consider to be the most effective over-the-counter night guard in the world. I designed the SmartGuard Night Guard with the same function and technology that I've used for my TMJ custom splints that I use on my own patients to get fast, quick TMJ pain relief. That technology has the highest possibility and highest probability to reduce the symptoms of clenching and grinding at night. As you'll see, it only fits on the upper front teeth, so the back teeth never come into contact with anything. This actually does more than just reduce your symptoms and more than just protect your teeth, because it does a great job at those. But it retrains your brain and jaw muscles not to clench at night. Because the fact is, when only your front teeth contact, your jaw muscles can't and don't contract nearly as much as when your back teeth come into contact. You'll have up to about 75% less biting pressure, which results in less pressure in the jaw joint and less muscle contractions, so that your symptoms go down or go away. The SmartGuard is easy to mold at home. We have how to mold videos that you'll receive. You'll get instructions in the packaging that is sent to you after you purchase, and we want you to watch those videos. We want you to watch them over and over to see and learn the tips and techniques to successfully mold the SmartGuard. As you'll find out, there's two designs of SmartGuards: the SmartGuard Original and SmartGuard Elite. The SmartGuard Elite is designed to fit basically every shape of mouth out there. However, if you wear dentures, or if you have a really small mouth, or if you have a sensitive gag reflex, then the original might be a better fit for you. I invite you to click on the buy button, and we'll ship the SmartGuard out to you within 24 hours. And this is my guarantee. I guarantee that the SmartGuard will reduce your symptoms, and that if it's not the most comfortable and most effective night guard that you've ever worn compared to over-the-counter night guards or even a custom-fit night guard, just send it back for a full refund within 6 months of your purchase.